I'm going to start by performing hand hygiene and gathering my supplies. Hi, my name is Irene. I'm a nurse practitioner student, and today we are going to be performing your abdominal, musculoskeletal, and neurological assessments. This shouldn't take over 20 minutes, and just for your information, we are recording this physical assessment. Do I have your consent to proceed?
Yes.
Excellent. All right, so I'm just going to have you confirm your first and last name for me, as well as your date of birth.
DK Slovak, January 1st, 1990.
Excellent. So my general assessment is you are alert and oriented. Your mood appears to be pleasant and cooperative. Your skin is even all throughout. I don't see any discoloration. Your skin color, it seems to be appropriate for your ethnicity. You appear to be well nourished, and you are in no acute distress. So that's great. I don't see any pallor, cyanosis, or jaundice. I don't see any discoloration or lethargy, which are all abnormal findings. So that's great. All right. So now we're going to start by assessing your abdomen. I'm going to have you lie on your back. Okay, and I'm just gonna lift your shirt up and inspect your abdomen. I don't see any lesions. There are no redness, no swelling, no bulging or masses. I don't see any pulsatile abdominal aorta there, so that's good. All right, and now I'm also looking at your umbilicus, and your umbilicus is inverted. I don't see any drainage coming out from your umbilicus. There is no piercing, no ulcerations or lacerations around your umbilicus, so that's great. Now, if I look on this angle, I'm looking at your abdominal contour, and I see that your abdomen is rounded, so that's good. And then if I look at this angle, I'm looking at your abdominal symmetry, and your abdomen is symmetrical, so that's great. All right, now we're going to move on to listening to your bowel sounds, starting from your right lower quadrant and then moving clockwise. And I'm going to listen to each quadrant for about 5 minutes each, okay? All right, so your bowel sounds are normal active. I heard bowel sounds on all 4 quadrants, so that's great. Now I'm just going to listen to your vascular sounds using the bell of my stethoscope, starting from your abdominal aorta, which is about 2 inches above your umbilicus. Now I'm listening to your renal arteries, iliac arteries, and your femoral arteries. All right, so I did not hear any bruit as I was listening to your vascular sounds. Bruit is an abnormal finding. It can indicate stenosis or aneurysms, and I did not hear that, so that's great. Now we're going to move on to percussion. I'm going to percuss your abdominal quadrants, again, starting from your right lower quadrant. All right, and I only heard tympanic sounds, no dullness. And now I'm going to percuss your liver, which is on your right midclavicular line, okay? All right, good. So normal liver span is about 6 to 12 centimeters. Yours is at 7 centimeters, so that's great. Now I'm also going to percuss your spleen, which is on your left upper quadrant, just about. I also noted tympanic sounds there. I did not hear any dullness. Dullness can indicate an enlarged spleen, and I did not hear that, so that's good. Now we're just going to listen to your costovertebral angle. So I'm going to have you sit up for me. And I'm just going to percuss your costovertebral angle. And you're going to let me know if you feel any tenderness as I do this, okay? Any tenderness?
No.
Any tenderness?
No.
Good. All right. So you did not have any CVA tenderness, and CVA tenderness can indicate kidney inflammation, and you did not have that. So that's great. All right. Now we're going to move on to light palpation. I'm going to have you lie on your back again, and we're going to palpate your abdomen. This is going to be about 1 centimeter for the light palpation. Let me know if you have any pain as I do this, okay? Did you have any pain as I was doing that?
No.
Good. So no palpation, no tenderness noted with light palpation. Now we're going to move on to deep palpation, which is about 5 to 8 centimeters deep, okay? Any pain or discomfort as I was doing that?
No.
All right, no tenderness noted. I also did not feel any masses or enlarged organs. I didn't feel any heat or warmth as I was doing that, so that's great. Now I'm also going to palpate your liver, which is again on your right midclavicular line, or about 1 centimeter below your costal margin. Any pain?
No.
No tenderness on that area, so that's good. Now I'm just going to palpate your spleen. Any pain?
No.
Good, so also no tenderness on your spleen. I also did not palpate your spleen. Your spleen should not be palpable. Now I'm just going to palpate your bilateral kidneys. Let me know if you have any pain as I do this, okay? Any pain?
No.
All right, so no pain on bilateral kidneys. I was also not able to palpate your kidneys. Your kidneys should also not be palpable, so that's a normal finding. All right, so that's great. Now we are gonna do what's called a rebound tenderness test. So I'm gonna put my hands on your abdomen, and as I release my hand, you're gonna let me know if you feel any pain, okay?
No. No.
Did you have any pain as I was doing that?
No pain.
Good. So if you had any pain, that would indicate peritoneal irritation or inflammation, and you did not have that, so that's good. Now we're gonna do what's called a Murphy sign test. All right. So I'm gonna have you inhale as I palpate your mid-clavicular line. Any pain?
No.
Any pain?
No.
Very good. So you did not have any pain as I was palpating that, and as you were inhaling, that means that your Murphy sign was negative, which is a normal finding. If that was positive, that can indicate liver inflammation or cholecystitis, which is like an inflammation of your gallbladder. All right, now we're going to do what's called obturator test. So we're going to have you flex your right leg at about 90-degree angle, and then I'm going to internally rotate your leg. Do you have any pain as I'm doing this?
No.
All right, good. So your obturator test is negative, which is a normal finding. If you had pain as I was doing that, that can indicate appendicitis or inflammation of your appendix. All right, great. So now we are going to move on to your musculoskeletal assessment. I'm just going to have you stand up for me, please. All right, good. So now I'm just inspecting, starting with your upper extremities, and looking at your scapula, shoulders, and your clavicle. I'm also looking at your elbows, your hands, and your wrists. I don't see any deformities, no swelling, no redness noted. Your skin is intact. I don't see any lesions or bruises, so that's great. Now I'm going to start palpating your upper extremities, again starting from your scapula to your shoulders, to your clavicle, to your elbows, wrists, and your hands. All right, I did not feel any warmth there, no asymmetry, no bulging, no masses, so that's good. Now I'm just going to raise your arms like this. Okay, no crepitus noted on your shoulder, and no crepitus noted on your elbows. And do this, and no crepitus noted on your hands and your wrists, so that's good. All right, so now we are gonna palpate your brachial pulses. Good, and your ulnar pulses, as well as your radial pulses. Your pulses are intact, they're about 2+ bilaterally, so that's great. Now we're gonna do your range of motion. All right, I'm gonna have you do an abduction and adduction. Good. I need you to shrug your shoulders, move them up and down. Okay, move them forward, backward. Great. Now I need you to flex your arms, okay, and extend. Okay. And then flex and extend. Okay, good. And then you need to pronate and supinate. Same thing with your hands and wrists. We're gonna flex and extend, pronate, and supinate. Excellent. So your upper extremities have a full range of motion, so that's great. Now we're going to assess your strength. I'm going to have you squeeze my hands as hard as you can, pull me towards you. Good. And move your hands up and down. Good. Raise your arms and don't let me push you. Good. So your strength out of a 5 out of 5 scale is a 5 out of 5 bilaterally, so you have full range of motion and full strength in upper extremity, so that's great. Now we're just going to assess your reflexes. I'm going to have you sit down again. We're going to assess your brachial reflex using my hammer. Good. And then we're going to assess your brachial radialis. Good. And then we're going to assess your tricep. Same thing here. Let's start with your brachial reflex, your brachial radialis, and your tricep. Okay, good. So your reflexes and your upper extremities are also intact, so that's great. Now moving on to your lower extremities, I'm going to have you stand up again, and I'm going to inspect your lower extremities starting from your hips. All right. I don't see any asymmetry. I don't see any bulging or masses. I don't note any swelling. I'm looking at your knees as well, your ankles and your feet. No redness, no swelling, no discoloration, no ulcerations, lacerations, bruises. Your skin is intact, so that's great. All right, now I'm just going to palpate your pulses, starting from your popliteal, and then your dorsalis pedis, and your posterior tibial. Okay, your pulses are all intact on your lower extremities. They're about 2+ bilaterally, so that's great. Now I'm just going to palpate your hips. I don't feel any asymmetry or deformities. Palpating your knees. I'm palpating your ankle and your feet. I don't feel any warmth as I'm doing this. Do you have any pain as I was doing that?
No.
No tenderness noted as well. And I did not feel any swelling or asymmetry, so that's good. I'm just going to have you bend your hips a little bit like this way. No crepitus noted on your hips. And I need you to flex your knee for me like this. Okay, and same thing on the left knee. No crepitus noted. And I need you to dorsiflex your feet for me. Okay, dorsiflex. And same thing with your left foot. All right, no crepitus noted as well, so that's good. All right, now we're gonna assess your range of motion on your lower extremities. Starting with your hips, I'm gonna need you to duck and a duck, duck and a duck. All right, flex and extend, flex and extend. Okay. I need you to flex your knee as well and extend. Flex your knee and extend. All right, same thing with your ankles and your feet. You're gonna dorsiflex and plantar flex. You're gonna pronate and supinate. Same thing with your left leg, or sorry, left ankle and left foot. You're gonna dorsiflex, plantar flex, pronate, supinate. Excellent. All right, so you had full range of motion in your lower extremities. Now we're gonna assess your strength. I'm gonna have you I'm gonna have you sit down again, and I'm gonna ask you to push your feet against me, like gassing a pedal. Gas, gas, gas. Good. Pull me towards you. Pull, pull, pull. All right, good. And for your knees, I need you to push me against resistance, or don't let me push you. Excellent. All right, good. So your lower extremities are also 5 out of 5 in strength, and you have a full range of motion in your lower extremities, so that's great. All right, now we're going to assess your reflexes again on your lower extremities using my hammer, starting with your patellar. All right. See, lift your leg up a little bit. Good. Excellent. And then we're going to assess your Achilles reflex. Good. Good. And then we're also going to test your Babinski reflex. I'm just going to stroke the sole of your foot. So just dorsiflex for me. Okay, good. Good. All right, so your Babinski reflex is negative, which is a normal finding, and your reflexes in your lower extremities are all intact. So that's awesome. All right, good. Now we are going to assess your spine. You could just like stand up for me. Okay, good. So I'm looking at your spine right now. Your spine seems to be symmetrical. I don't see any scoliosis. Your spinous process is in alignment and vertical, so that's great. And then if I look from this angle, I'm looking for lordosis or kyphosis, which is basically just an exaggerated abnormal curvature of your spinous process. And I don't see that, so that's good. And I'm just also gonna palpate your spine. I don't feel any bulging, no masses, no deformities. So that's good. Now we're just gonna assess your spinal strength, starting from your cervical. I'm gonna have you bend your head forward this way, then backward, then sideward, left to right, and then I need you to turn your head left to right, shrug your shoulders up and down, forward and backward. Excellent. So cervical spine is intact. Now we're gonna assess your thoracic spine. I'm gonna have you bend your hips this way, left to right, twist side by side. Good. Excellent. Now we're going to assess your lumbar spine. I'm going to have you move forward and backward. Excellent. So your spine is also intact, so that's great. Now we are going to move on to your neurological assessment. I'm going to have you sit down again, and we're going to assess your cranial nerves 1 to 12. Okay. So we're going to start on your. We're going to start with your cranial nerve 1. I'm going to have you close your eyes, and you're going to identify what you're smelling. I'm going to put something in front of your face, and you're going to let me know what you smell.
Alcohol.
Excellent. So it's an alcohol pad. That means your cranial nerve 1 is intact. Now I'm going to assess your cranial nerve 2, which is your optic nerve, using my ophthalmoscope. Okay. All right. So your optic discs are sharp and well defined. Your retinal background is intact. Your red reflex is present. So that means your optic nerve or cranial nerve 2 is also intact. So that's good. Now we're going to assess your cranial nerves 3, 4, and 6 using my cardinal fields assessment. So I need you to follow my finger only with your eyes. Okay. Excellent. So you did that at ease. I did not see any nystagmus or abnormal eye movement, so that's great. Now I'm just going to shine a light on your left eye. And I saw your right eye constrict as I was doing that. Now I'm just going to shine a light on your right eye. And I see that your left eye was constricting as I was doing that, and that's your pupillary accommodation. Your pupils were also both equal and reactive to light. They're about size 3 millimeters, which is what's normal. So that means that your cranial nerves 3, 4, and 6 are intact. So that's great. All right, now we're going to move on to your cranial nerve 5, which is your trigeminal nerve. I'm going to have you bite down in your cheek or clench your teeth. And I'm palpating your masseter and your temporalis. I feel strong muscles there, which means that your cranial nerve 5 is intact. Now we're going to move on to your cranial nerve 7, which is your facial nerve. I'm going to have you raise your eyebrows for me. Close your eyes shut. Good. Smile for me. Frown. And puff out your cheeks. Good. So you did all of that with ease, which means that your cranial nerve 7 is intact. Now we're going to move on to your cranial nerves 9 and 10. I'm going to have you open your mouth and say, ah. Good. And then I have a tongue depressor here. I'm just going to assess your gag reflex. I'm sorry in advance, okay? Good. So your gag reflex is also present. That means your cranial nerves 9 and 10 are also intact. So that's good. Now I'm going to have you, we're going to assess your cranial nerve 11, which is your spinal accessory. I'm going to have you shrug your shoulders, up and down. Okay, and then move your head towards the left side against resistance. All right, now right side against resistance. Excellent. So strong muscles there too. That means that your cranial nerve 11 is intact. Now we're going to move on to your cranial nerve 12. I'm going to have you stick your tongue out and move it side by side. Excellent. I see strong tongue muscles there, which means that your cranial nerve 12 is intact. And I know that your cranial nerve 8 is intact because you were able to hear me and follow my directions. So that's all your cranial nerves 1 to 12, and they're all intact, so that's great. All right, now we're going to move on to your cerebellar function. All right, starting with what's called rapid alternating movement. I'm going to have your hands on your lap, and then I need you to turn them front and back as fast as you can. Good. And you're past that rapid alternating movement, so that's great. Now we're going to move on to what's called a finger to nose test. So I'm going to have you touch my finger with your pointer finger and then touch your nose. Touch my finger, your nose, my finger, then your nose, my finger, then your nose, my finger, then your nose. Great, your movement was coordinated, so that's great. Now we're going to do what's called heel to shin test. So I'm going to have you run your right heel up and down your left shin. Same thing to the other side. Excellent. I did not see any tremors or ataxia, which are abnormal findings. Your movement was smooth and coordinated, so you passed those tests. That means your cerebral functions are intact, so that's great. Now we're going to move on to your sensory functions, and this test will include you telling me if what I'm letting you feel is soft, dull, or sharp, okay? So I'm going to have you close your eyes and identify this feeling for me.
Soft. 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 Soft.
Good. And now we're going to move on to the next object.
Dull. Dull.
Excellent. And for the last one.
Sharp. Sharp.
Excellent. So you also passed that test, which means your sensations are intact. Now we're going to move on to what's called proprioception. So I'm going to have you identify if I'm pushing your toes upwards or downward, okay?
Down. Up. Down. Up.
Excellent. So you also passed your proprioception test. Now we are going to move on to vibratory sensations. So you're going to let me know if you're feeling the vibration or not. And I'm going to start on your great toe. Close your eyes for me.
Yes.
What about now?
No.
Good. I'm going to do the same thing.
Yes.
What about now?
No.
Good. And then I'm going to do the same thing here. Close your eyes.
Yes.
What about now?
No. Yes.
What about now?
No.
Good. So your vibratory sensations are also intact. That means your sensory functions are also intact. So that's good. Now we're going to move on to your cortical functions, starting with your stereognosis test. So I'm going to give you some objects and you're going to identify what objects I'm handing you. Okay, so I'm going to have you close your eyes. And let me know what that is.
Favorite thing.
Good. Now I have another object. Let me know what that is.
Key.
Excellent. And the last one, with your right hand.
Huh.
Excellent. And you identified those objects correctly, which means you pass your stereognosis test. Now we're going to do what's called graphesthesia test. I'm going to write down a figure on your hands and you're going to identify what it is that I'm writing on your hands, okay? So keep your eyes closed.
Number 8.
Okay, good.
Letter 8.
Good. So you also passed your graphesthesia test, so that's awesome. What else? All right, so now we are going to move on to your graphesthesia. We're going to move on to 2-point discrimination test. All right, so you're going to identify if you're feeling 1 touch or 2 touches, okay? Close your eyes for me.
1. 2. 1. 2.
Excellent. So you also passed your 2-point discrimination. Now we're gonna move on to extinction. So I'm gonna have you close your eyes and you're gonna identify where and what location or what area I'm touching you. Okay?
Cheek. Left cheek.
Good.
Both arms.
Good.
Left knee.
Good.
Both shins.
Good. So you also pass your extinction, which means that your cortical sensations or cortical functions are all intact. So that's great. All right. So now for the last exam, we're gonna assess your gait and balance. I'm gonna have you stand up and walk across the room. Excellent. All right, good. All right, so your balance is coordinated and steady. I didn't see any wobbly movement, so that's good. Now I'm gonna have you walk with just your toes, tippy toe. Excellent. Now I'm gonna have you walk with just your heels. Heels, 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 excellent. And your gait is also steady. I don't see any wobbly movement, so that's great. Now we're gonna do what's called a Romberg test. So I'm gonna have you put your feet together. We're gonna count to 10. Feet together. We're gonna count to 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now close your eyes for me. We're gonna do the same thing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright, so you did that. You did that at ease. I did not see any swaying movements, which means you have passed your Romberg test. Alright, so that's great. Now for the last exam, I'm gonna have you sit down, and then we're gonna assess your pronator drift. So I'm gonna have you lift your arms as if you're carrying a box of pizza. Yep, palms up, and close your eyes, and then we're gonna count to 10. Just keep your arms up for me. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Great, so you also don't have any pronator drift. I didn't see any drifting there, so that's awesome. That means that your balance and coordination is also intact. So that basically completes your abdominal, musculoskeletal, and neurological assessments. Do you have any questions for me?
No, thank you.
Thank you for your cooperation.